Hello and welcome to the Braincast. My name is Michael Rataj. I am here with Sanket Gohil from Novacare in Six Corners. We met via the Six Corners Association, and that's part of what this is about. Meeting local business owners in my neighborhood to connect, see what's working for them. It's been so just kind of how the neighborhood has changed and how that's helped the business. So I've just been here for, I think, 4.5 years.
Mm-hmm.
Have you since 2009? Is that here, or
no.
when did you guys get started here?
We got started here in November of 2019 when we opened up. We started November of 2017.
17. Okay.
And then that's when we opened up. The doors were open, but practicing actively around March of 2018 when we started seeing patients.
Right.
And then I've been here since May of 2018. That's when I started as a site supervisor over here and a physical therapist.
So you've been practicing since 2009, focusing mostly on the spine. So lumbar and cervical, that's
neck and your lower back.
Neck and lower back. So this might be kind of quick into it, but I'm assuming with phones, you get a lot of the...
Yes, definitely. Nowadays, people using their phones. We have what's called a text neck syndrome, where people, you see people all the time at bus stops, train stations, even walking. They're looking down on their phone. So we get a lot of, younger people, especially with a lot of postural issues that come in for neck pain. Of course, you have your typical desk job office worker just sitting all day, and they come in with their low back pain. And we also have a lot of other people coming in, that from work injuries that come in with low back pain or neck pain or any other issues as well that come in. So, we do physical therapy for all of those individuals.
Do you find, is it majority from desk people, or is it just the kind of labor work-related issues?
It's lower back is probably the most common condition that people come in, and it's kind of from all over. I would say could be a construction worker that injured themselves or a desk job, but low back seems to be in the physical therapy. That seems to be one of the most common condition that's seen in our office and practice. For a majority of it'll probably be at least 50% of our clients would be suffering from some kind of spine issue. Yeah, just because it's that common and prevalent amongst the common population.
So, would you say that's because of one typical thing for a lot of people? Like, people are just sitting poorly with posture, or is it other behaviors that people need to actually pay attention to not have that problem?
Yes, so most common would be posture. So most of our days are spent sitting, or either we are bending, or either we are lifting. So most of the days we are actually kind of what we call is a forward flexed posture, where our spines are more sitting in a C-shaped compared to an S-shaped curve, which is a normal curvature. Yep. So that is certainly a predisposing issue that leads to neck or lower back pain for majority of people. And you'll see people sitting in their cars, kind of slouching on their desk when they're on their computers. They're slouching with their forward head and then curved backs. Even when you're lifting, people when they're lifting at work, they're bending from their back rather than bending from their knees. They say we bend on a 24-hour period. We bend about 1,000 to 2,000 times. So that definitely takes a toll on the lower back, and that's why we see so many people at these on a daily basis.
I've noticed that, especially with driving. I feel like that's where I guess on the computer editing I slouch a lot. But are there any tips do you give yourself to make sure? It's kind of, you just got to be aware, but if 24 hours or 18 hours a day, I'm sure it's easy to slip your mind when you're doing other things. Just think about posture.
Yes.
are there tricks that you use? I mean,
Definitely, yeah.
desks high up
Mhm.
and make sure you like, because if you set yourself up
Yep.
lower, you're
Mhm.
setting yourself up for failure, right? Like,
Yep. So yeah, number one is, so if someone comes over here, that's a major part of our rehabilitation, is kind of educating them on what correct posture is. We go over, talk to them, and ask them how their desk is. We give them ideas on making sure the desk is at at an appropriate height, where the elbows are bent to 90, making sure the chair is pulled up under their desk, so they're as close as they can without being uncomfortable. Making sure the monitor is at the right angle facing them, so they are not having to look down all the time, which makes you slouch. And then the one major tip we give is having a good chair. I think that makes a big difference. So having a really good chair, and what we do is we have these rolls, we call lumbar rolls, which you can actually have it behind your back when you're sitting. So the roll is automatically going to push you up and make you sit in that S curve I was talking about. And if people use that throughout their day, they certainly have less symptoms. And it actually prevents you from getting low back pain in the future. So good posture is key.
So then, I guess I've seen that with towels, but you're saying it's a little, just a foam.
Yeah, it's a foam roll. You can find it on Amazon or any medical store or pharmacy. It's made out of foam, but sometimes if people are too lazy to get that, then I will make a roll with towels for them, tape it up, and make it for them. But yeah, there's readily available, so they're very easy to find.
Save you a lot of headache.
Yeah.
A lot of backaches.
Right?
Okay, so that is it. How did you get involved with this? Is this sort of family? Is this you just interested in
physical therapy in general? Yes, So when I was in school, one of my uncle was actually an orthopedic surgeon, so he kind of steered me in this direction, and that's how I got started in physical therapy. Basically, when I was graduating school, from undergrad, physical therapy was this new kind of upcoming profession. And he being an orthopedic surgeon, he used it a lot. And then I got to shadow a few therapists that were working, and that's how I got piqued my interest into it. And once I got into it, I worked with a lot of different mentors, and one of my mentors was really an expert in treating the spine and the neck, lower back and the neck, and that's how I got my interest in working with spine conditions.
Mentors are key.
Key, definitely, yep.
Do you still keep in touch?
Yes, I do sometimes, yep. But some of them are retired, so it's kind of hard to kind of connect with them. But yeah, definitely, time to time, yeah, definitely keep in touch.
Still like a lifelong friendship after the mentorship, That's good. Yeah, that's how you just kind of get into stuff.
Yeah, exactly, yeah. It's kind of guide you.
So with this, do you focus more, so obviously there's a bunch of exercise equipment. Do you feel running, like what's your thing? Are you a runner? Do you like biking, or you just?
I'm more into sports. I like playing tennis. I just like more kind of the fun participative aspect of sports. So I do that, and then I do hiking a lot. So we try to hit all the national parks every year, and just go hiking. So that's two of my favorite things to do. So
are you from here? What I'm trying to think of by the North Branch. Do you go there? Like Devon, is it Devon and Milwaukee where it connects?
Yeah, I haven't been.
By the Superdog?
No, I've kind of biked a little bit over there from time to time, but I haven't really hiked. Typically try to go like Michigan, and we go to Colorado for hiking. So, and whenever we can get out and escape a little bit.
Yeah. So what part of Colorado? Do you have a spot, or?
We usually go to the Rocky Mountain National Park. So it's just really easy to get there, and then we've done a bunch of hikes over there. We like to drive up to the top and then take the hikes from there.
So you like going down? Or just going up?
Going there, and
Going even
then
higher?
they have trails over there that go, and then we go to a point, we can get like really nice views over there, and it's actually really pretty spectacular.
No,
Especially living in the Midwest, you kind of
Right.
not have appreciation for the mountains. So.
that's been one of the spots for me, just Colorado. I just filmed a wedding there in May,
Mhm.
and I just love, like, every
Yeah,
time
it's
you
beautiful.
just drive through there, it's just kind of like,
Yeah, I
you know,
really.
Vegas is nice with the mountains, but there's something
Yeah.
else about Colorado that's just
Mhm.
like more, I don't know, natural. I don't know.
Yeah,
natural
yeah.
the
It is
right
more,
word, but
yeah,
it's just
more outdoors, more natural, yeah,
more
untouched,
connected.
yeah.
Yeah.
Mhm.
There you go. So, yeah, I know. Driving, it's like the best spot to actually sit in traffic. You know,
Yeah.
like,
Yeah.
you're gonna sit in the middle of the
Yeah.
mountains.
Yeah.
Which is annoying anywhere.
Yeah.
So, Colorado, I love that spot. Are you more personal? Are you a beer drinker, or do you stay away from alcohol?
I used to drink beer. I was really into IPAs for a while, but I'm gonna cut down just for the health aspect of it. Yeah, but I do like a good beer once in a while. Definitely try to hit some of the craft breweries around Chicago, which we have a lot of. So, just amazing. I don't know if you've been to Three Floyds.
Oh yeah.
Yeah, that's one of my favorites.
Yeah. I do another one of these for beer, and we were just interviewing the owner of Old Irving Brewery.
Oh yes. Mm-hmm.
Trevor.
Mhm.
He's a real good guy.
Yeah.
And him and Andreas, actually, it's a two-man team, and
Okay.
they're working together,
Mhm.
to see the vision of the place, and it's just so. But food, I would like. This is a side, I guess, commercial for them, but the food over there is really good too.
Okay.
But that's what's nice. Like our area, I think we're just so,
Yeah.
food and.
Yeah. It's pretty chill out. Yeah.
So you coming involved here in May, when whereabouts in Chicago do you live?
I live in Wicker Park.
Wicker Park. Okay,
Mhm.
so that's okay. So this area especially has been, like I said, we were here 4.5 years ago. So
Mm-hmm.
it's been, not a lot
Yeah.
of stuff, and then we've kind of really seen it
Mm-hmm.
just sort of build up, and it's been a nice change to the neighborhood, to say
Mhm.
the least. Like, we started in Logan Square and then just kind of pushed our way out
Yeah.
here for
Yep. Yeah.
price and
Mhm.
area, backyard, I guess. So
Mm-hmm.
it's cool though. So food, what do you do in the area? Do you bring your
I typically
food, or
bring
do
my
you
lunch,
go-
but I go to the City News Cafe a lot.
Oh, yeah.
Yeah.
Where?
Yeah, because since they're our neighbors, I've been there. I've been wanting to go to some of the restaurants in Milwaukee. When I get a
The new
chance.
ones, yeah.
Yeah.
Yeah, Fishman's just opened.
Yes, and then was it the French Room?
French Room, yeah.
Mm-hmm.
Such a Chicago. That's so funny.
Yeah.
That's just.
Yeah. So, but yeah, definitely it's a good vibe to the neighborhood. I really like it. Yeah.
Yeah, community. What is it? Community, Josie's, the frozen yogurt,
Mhm.
Fishman's. With 2112, we did a happy hour there
Mhm.
last week or 2 weeks ago. And they have like some nice truffle parmesan popcorn
Oh.
at Fishman's. So
Oh, okay.
it
I'll
was-
definitely
it was
try.
really nice. And then, I don't know if my wife and I, we are huge in Mexican food.
Okay.
So we at Irving and Central, the Amigo Chino. Have you ever eaten there?
No.
It's so gluttonous
Is it?
of food. Like this is like the ladies hold it like this, like on their tray, like single plate,
Uh-huh.
like, and then two hands to drop. It's just, it's way too much food. But if you like Mexican food, that's one good spot.
Okay.
And then Simone's, I think, didn't they just open on Milwaukee and
Mm-hmm.
Belle Plaine?
I think Milwaukee, has a lot of stuff
Yeah.
going on there.
That was usually get my hair cut there.
Yeah.
But yeah, it's that's what's nice too. It's again seeing that get built up from just like nothing.
Yes.
Community wasn't there. French Room,
Mhm.
Fishman's. It was basically the Filament, and then that other Mexican place next to the costume store, and then but it helps, and obviously to come here. So
Mhm.
like the way you guys, how did this? Because Novacare, it's part of the franchise. Or how does
Novacare is a company. Yeah, they have locations around Illinois and some other states. It's part of Select Medical.
Okay.
That's the company that's
The parent.
parent company that owns the Novacare. So we do have locations around Chicago. We have in most of the neighborhoods, Wicker Park, Logan Square. We have one here, a couple in downtown, and then around Naperville and suburbs and everywhere else too.
Mm-hmm.
But we kind of pride ourselves in being more of a kind of local community-based company because we try to kind of embed ourselves within the community, and not be just that another
Right.
kind of chain just
Yeah.
kind of showing up there with no character. So definitely we do a lot of initiatives around around Chicago with the Chicago Area Runners Association. So when they prepare
Okay.
for marathons,
Yeah.
um,
Oh yeah, that's right. That's right. I always saw you guys.
yep. So we're always there around marathons, around marathon training, help the runners out, and then if they have any issues or problems, we guide them to the local neighborhood where they live, and then they can go to a Novacare over there. So it's kind of great to see kind of runners coming in with
Right.
injuries and then go finish a marathon. It's
Yeah.
it's really amazing to see.
Yeah.
So yeah.
You're just thinking of that, another really good neighborhood, and you're mostly tennis, but if a cool neighborhood thing could be an actual running group,
Mm-hmm.
like either weekly, just kind of like set it up,
Yeah.
like allow people to meet here if they want, and
Mm-hmm.
then, like that could be a cool way to sort of embed yourself even more.
Yeah,
And
that
then
can definitely do that.
If you do it as weekend things, you can do, start here and then end at a brunch place, kind of thing, and then that way you can kind of
Mm-hmm.
awareness to obviously you guys helping out runners that way.
Mhm.
In the beginning, when someone comes in, oh well, this is hurting, oh well, try this stretch.
Yes.
You try doing these, and then
Mm-hmm.
because that
Yep.
could be another cool way to
Yeah. So we also do complimentary injury screens. So anyone can walk in here and say, "Hey, I
what's
was
going
playing
on."
tennis yesterday and my shoulder hurts now."
Mhm.
We can definitely take a look at it, see what's going on, and let you know. Give them a few exercises to try out, see if that helps, and usually which helps most of the people, and
Right.
then they're good. If not, then they can definitely come in for a formal evaluations. They can come in, we can sign them up, do insurance verifications for them. Kind of
Right.
go the extra mile and make sure everything is good before they come in for physical therapy, and then do a formal an hour evaluation, and then get them set up for physical therapy.
Mhm.
And the cool thing now in Illinois allows direct access. So a person can walk into a therapy clinic without a referral from their doctor and start seeing a physical therapist immediately. So which is cool.
That's
Instead of going around doctors for things where a physical therapy can step in directly. Like I've been talking about, like low back pain, neck
Mhm.
pain, shoulder pain. Which physical therapy can help immensely with. They just kind of walk in here and just take that weight out of the process and just kind
Right.
of get treated right away.
which can be a real pain both ways.
Both ways. So yeah.
If you're hurting and just like I want some,
Exactly.
yeah.
Mhm.
'Cause when you get it, it's just like it
Yeah.
sucks. It's,
Yep,
like,
exactly.
terrible.
Yep.
Just-
So you want someone immediate. So like over here, we try to do appointments within 24 to 48 hours.
Nice.
Get you in. Sometimes we do same day if we have the availability. If you're really hurting,
Right.
we want to help you as soon as we can.
Exactly.
And then we also work with orthopedic doctors and surgeons in the area. So like it's something that is out of our scope. Then we can have like good relationships with doctors where we can like, hey, I have this person. I don't think really it's something more else is going on. Then we can kind of get them in as soon as they can. And since we have that connection with the doctors, they're
Right.
usually able to get them in much sooner.
That's great.
Because sometimes it's a big pain to see specialists.
But yeah, other referrals and connections. That's
Mhm.
easy way to do it.
Mm.
Wildlight. Have you heard of that? The yoga place.
Uh,
I think they're just opening.
yes,
That
I
might
have.
be
Yep.
Good.
Good way to connect.
The two
Because
of
I
you
saw that
guys
in the
together.
email, and I think they're doing an event for the for the
actual-
neighborhood. Yeah. So yeah. So definitely hook up with it. Yeah.
So, what is the McKenzie method?
So McKenzie method is an approach. It's a system actually that we use in physical therapy that I'm trained in. You train that. It's about 90 hours of training in that. Basically, it's an approach to assess and evaluate a patient that comes in with any sort of musculoskeletal problem.
Okay.
And we're based on that evaluation and assessment, we're able to kind of, tailor make an exercise program for them, which is kind of specific to their problem, which is easy to do, and has immediate response.
Okay.
So if we assess correctly using that method, we're able to help 80% of the people, get relief from their pain within 48 to 72 hours.
Oh, nice.
Yeah, so and it's very, very effective for low back pain and very, very effective for neck pain.
Okay.
Also effective for shoulder, knee, ankles. It's just a more detailed and more systematic way to assess, evaluate, and then treat people and give them a very individualized exercise program.
Gotcha.
Which sometimes where sometimes you have physical therapy where you go and you do multiple exercises and where it's not very specific, but this is meant to be more specific to get to the root cause of the problem. Once we fix that, then we can rehab you to get back to whatever sport, activity,
Right.
or work you need to do, which will involve the activities that you do normally.
Yeah.
Mhm.
So what? So I've never heard of that. So what is it? Obviously, that's what it. I mean, thankfully, I've never heard of it because I haven't had
Yes,
issues
yes.
too much. But so, what? I don't know. I guess you kind of mentioned it. So it's special because it actually.
Yeah.
So it's so quick acting.
Yeah, so there are specific exercises that we show
Gotcha.
to them. So a lot of people. So like I said, 80% of the people bending most of the time. There are specific exercises that we call them extension exercises. So when a lot of times help people coming for low back pain. Every time they bend, they hurt. So we actually find, okay, this is what's hurting. Then we find the movement that actually gives them relief, and then we give specific exercises that matches the movement. For 80% of the people, that's extensions. So I don't know. I know in yoga they call it the upward dog or the
Yeah.
cobra position. It's kind of
Cobra.
it's similar to that, but it's more kind of focusing on going to the actual spine versus strengthening anything. And once you go there, and it actually, what it does, it corrects the small little misalignments in your spine. And once you correct that, then that's when you see a kind of a rapid response, so to say. So same thing we have in the neck. There's certain movements we can do where we go back, to align the spine a little bit better. That helps them to get rid of the pain. And I have patients that go home, do it for a couple of days, and then they come back like, oh, this was like magic, or they come the other way, like it hurts a lot. Then we can assess and
Right,
go back and then reassess and see what helps them after that. So
Okay.
I really like that kind of systematic process rather than just kind of using what I call a spaghetti approach, where you throw everything on the wall and see what sticks. Yeah.
That's a little more focused.
Yeah, it's more focused and individualized.
So, on that, so I guess some preventative stuff that we've sort of talked about.
Mhm.
Well, I mean, just kind of watching that with the spine,
Mhm.
how do you feel about yoga? Do you think
Yoga
that's
is-
good in general, like
Yes, it's great.
preventative.
Yeah, so me personally as a PT, I do, once patients are done here, I sometimes, if it is appropriate for that individual, I do recommend to take up yoga. It's definitely a good activity that patients can do to kind of prevent stuff, from happening.
Yeah.
And, it just keeps you flexible and strong and active. So definitely will recommend yoga to a lot of my individual
Yeah.
clients that come in.
Yeah, I used to do it like 3 times a week, and
Mhm.
it was like the best I ever felt.
Exactly.
It was
Mhm.
like felt so good, and then I left my job downtown, and then it's like
Yeah.
it's not easy to get into some regular schedule now.
Mm-hmm.
Any other big, I don't know if big or just like preventative kind of things that you could like the run? I know. I guess maybe I know the running. There was Fleet Feet does the good form running
Yes.
classes.
Yep. So some of our locations also have gait analysis and running analysis. So they'll put cameras and put you on a treadmill and see how you're running, and then it measures all the aspects of your gait and running cycle, and then based on that, we can tell you what's going on and kind of show you some preventative stuff to kind of do that, so that you don't get injuries from running. We also show them a lot of foam roll stretches and dynamic stretches that they do before and after running. That helps preventing a lot of running injuries also, and then definitely a lot of strengthening exercises, a lot of your hips and knees that need to be strong for running, so we do a lot of hip and knee strengthening exercises also.
This may be too vague of a question, but I guess so. I'm assuming like I know my biggest problem is that like I'm just weighted more on one side, whereas like when I'm standing, I end up leaning to my right or left or something. Do you find that it's just being cognizant when you're standing to make sure you're just even, like in yoga, it was the mountain pose. Where they just make you like stand there, push on the front of your feet, I think is where you push your weight.
Yeah.
Like, is that kind of the best thing that you would think for like someone where I know that I'm leaning, like just kind of be aware and just level out?
Awareness is very important, just kind of knowing how your posture is throughout the day. But the other thing is just correcting it. So what I tell people, if you find yourself in a bad position or posture, a lot of people lean one way when they're sitting on a chair. A lot of people, you see all of them, I call them like kind of just, they're hanging on their hips a little bit. They're like, their hips are swaying forward.
Gotcha.
So I always show them, a corrective exercise where I say, okay, just kind of get out of their posture, count till 10 seconds, and then you can relax and go back to that posture. And the next time you find yourself in that posture, and just do that. Typically takes them about 2 to 3 months, but once you learn that, you kind of unlearn the bad habits and you learn the good habits. So if you're shifting on one side, just make sure you're shifting equally on both legs. Watch yourself in the mirror if you can, and see how different you look. And it just gives the body a feedback that, okay, this is good posture, and then eventually the body will start kind of correcting, staying in that position automatically.
That's good too that you said 2 to 3, like stick at it.
Like
2 days and it's like,
exactly.
Don't be sloppy.
That's why when people give up, so I say like this is not you won't be fixed in Monday. Exactly. And I wish it was.
Right.
But some of the habitual postural issues, it just takes time because it took time.
Years to get this way.
Exactly. So it's going to take at least a couple of months to get better at it. So, yep.
That because it's all about retraining your muscles.
Yep, retraining your muscle and also re-educating your brain to know, okay, now this is not, my slouch is not the right way. This is the good way to sit.
Right.
And so a lot of people use the word like muscle memory loosely, but I guess that would be a word to use, easier to explain it. So it's muscle memory. So you're actually teaching your brain to remember what good posture is.
Nice. Okay.
So it's not like, like a lot of people kind of avoid using the words, telling people that you're weak or you're tight. Then people that kind of plays on their mind is like, oh my God, I'm getting weak now, or I'll never be able to get strong again. They're like, no, you just forgotten how to do it. You just have to teach yourself to do it correctly, and it kind of people understand that better, and kind of then they stick with it longer.
And on that note too, you kind of got me thinking, because for a while I was just big into running, and that's all I would do. But then once I got more into weights, I noticed that my running was a little better. Like once I'm strengthening my legs. And,
exactly.
So would you agree that like just the strength and a cardio kind of like do them all instead of just trying to focus on just biking or running? Like,
yeah, so
incorporate some.
you definitely need to incorporate other things to make sure you're stronger also in the muscles that are required for the activity that you're doing, because otherwise, you started running and you all had certain muscles that are weak, certain
Right.
muscles, that are not firing properly when you're running, and if you haven't trained them and you keep running, you're going to end up with certain type of stress injuries or whatever. So you have to have a supplemental strengthening or stretching or a balance program or whatever that you need along with it to make sure that when you're doing it you're not stressing your joints.
Balance. I think that's the word
Yes.
to really focus on
Yep.
with exercising, because then you're.
Yes.
Because that's the key.
Yep, exactly. So CrossFit is getting popular, but I would say that's why it is, because people are using other activities to get strong in so that they can get better at their own sport. So.
Right. Makes sense. What about work conditioning? What is that?
So work conditioning is a service that we offer for injured workers that have completed their physical therapy, but are not fully ready to start their job. Typically, it's people who have a heavy job to go back to. And a lot of people work at O'Hare, baggage handlers, or people that are into constructions, things like that, which is, after an injury, once you do physical therapy, sometimes if sending them back directly to work, there's chances that they may re-injure themselves.
They're still weak.
Yes, so they can start a work conditioning program, which is typically 4 hours a day of exercise, sometimes 5 days a week, sometimes 3 days a week. But they come here, they work on the strengthening, lifting, pulling, pushing, all the activities that they're going to do at work. So we try to simulate as closely as we can,
Right.
using the equipment we have here, so which actually gets them ready to go back to their full-time work, and it actually reduces the chance of re-injury. So yeah, we do that over here as well. So a lot of the workers that once they're done, it's like, hey, I don't feel you're completely ready, but we can try this transition. It's more of a transition
Right.
program that they do, and once they do, then they feel more confident physically and mentally that they are ready to kind of resume their work, because it's a very not just physically but just kind of psychologically, it's a very traumatic thing to get injured at work and knowing that you may not be able to go back to work. So
Right.
this kind of slowly builds their confidence, like, hey, you're ready and you can go back to work.
Right. And that, I guess you kind of said that, but so it's basically to strengthen, like, because the reason they got hurt is because they were incorrectly doing something. most
Incorrectly, yeah, or
weak,
accident, or
Right.
sometimes a lot of time it's an accident. Sometimes they're following poor ergonomics, lifting incorrectly, things like that, or just just overuse because
Right.
just doing the same thing for
12
years.
hours, yeah.
Yeah, so eventually something's gonna give. So yeah, so that immediate issues we take care in like a formal physical therapy program, and then once they're done with that, then we kind of focus on the general strengthening, functional strengthening, stretching, cardiovascular conditioning, basically putting them through all the tasks that they'll need at work.
Nice. Cool.
Mm.
So that's a good, that helps prevent. It's a better preventative thing
Exactly.
too, to really get you prepared for the next sort of event or what have you. So
Yeah.
Oh.
Yeah, but we are here
Oh, you
Monday
actually-
through Friday.
You went to college in India?
Yeah.
How long did you live there?
That's where I grew up.
You
So
grew up?
yeah, I was born over there. That's where I did my physical therapy school, and then I did my master's at University of Pittsburgh. That was focusing on musculoskeletal conditions, so orthopedics. So it's more of like a specialization degree.
So that was your first 6 years you lived in India?
Yeah,
24.
25, yeah.
25. So how often do you go back?
I go every couple of years or every year if I get a chance.
Possible.
Yeah.
Parents still there?
Parents still there.
Wow.
Yep.
So you any family here or just?
I have a couple of cousins that are in California, but yeah, me and my wife both from India, so I guess she has some family here.
Okay.
Again, cousins, but yeah, no immediate family here. Yeah.
Well, they become, like. If they're
But all our
cousins,
friends, all our
hang
friends.
out more and then, yeah. Cool. Well, that's pretty wild.
Yeah.
What is that the 12-hour flight or is that even longer?
16 hours.
16.
Yeah. Yeah.
Straight.
Yeah,
Straight, or is that
from
with a layover or like a stop somewhere?
from New York. So from New York, yeah,
So, okay.
yeah. So I guess 18 hours.
So even.
From Chicago to New York, and then from New York to India. Yeah.
Yeah, you need 2 days, one to get back.
So yeah, long vacation time.
Cool. Well, welcome to Illinois.
Yeah.
Thanks to welcome to Portage Park.
Thank you.
Yeah, you're at 4008 North Cicero, Novacare. 773-283-5398. And I'll link stuff
Okay.
at the page.
Sure.
Thanks for coming out.
Thank you very much.
Thanks for me coming out.
Yes.
Thanks for talking.
No, thank you. Appreciate you coming out. Yep.
This rainy day, I'm glad it'll be an interesting background for everyone. So,
All right.
thanks for paying attention, and see you around.